Hi everyone, today Shafika and I will be presenting our logbook which is based on black ginger. The aim of our logbook is to optimize the sterilization technique and growth regulator for in vitro propagation of black ginger. Black ginger is a medicinal plant highly known for its anti-inflammatory, anti-allergy and anti-cancer properties. By using clear tissue culture method, we are able to grow the plant with low contamination risk.
So we'll first look at our sterilization protocol. Our objective is to assess the efficacy of surface sterilization of black ginger leaf using 40% and 60% Clorox concentration to ensure the removal of microbial contaminants. The standardized protocol for all three tests begin with collecting the leaf from the farm, followed by washing them using a baby brush. Leaf will then be placed inside a jar containing 40% and 60% Clorox concentration and add few drops of 220. Next, rinse the leaf with water use 3 times and cut the leaf to 0.5 by 0.5 cm using scalpel. Place 3 pieces of leaf onto the media gently and observe for contamination after a few days. We observed contamination across one media for 40% concentration, but the contamination was on the media itself, not on the leaf. So we concluded that our techniques were not strict enough. Therefore, for test 2, we decided to thoroughly check our techniques to reduce contamination. However, we still observe contamination, but this time on the leaf. So we know that we need to modify our procedure for the final test. Possible reasons for this includes our handling technique during the transfer, or we might left the plates open for too long, therefore allowing airborne microbes to settle on the media. Next, lower concentration of Clorox may also not be effective to eliminate all the microbial contaminants. So after consulting and reading research papers, we decided to soak our leaf in 100 ml of fungicide for 10 minutes before proceeding with our standardized procedure, and also reduce the soaking time in Clorox to 10 minutes for both concentrations. With this modification, no contamination were observed even after 27 days for all concentration. Based on our results, we can do our data analysis and came up with hypothesis. Our null hypothesis is there is no significant difference in the sterilization efficacy between the two concentration. And our alternate is there is a significant difference in the sterilization efficacy between the two concentration. The p-value came up to be 0.158, which is greater than 0.05. So there is not enough evidence to reject the null hypothesis. Therefore, there is no association between the sterilization efficacy between the two concentrations. Our overall success for this protocol can be considered successful after some modifications were made along the way and the expected outcome was achieved. Some challenges we face include improper tool sterilization and handling techniques. Therefore, for future improvement, all tools should be thoroughly sterilized and also minimize the time the plates are left exposed to open air.
Okay, now I will explain the second protocol, which is about a callus induction. Our main goal is to see how different media composition help in forming callus from leaf expand. We also want to find out which combination of plant growth regulator work best for inducing callus formation. For this experiment, we are using a black ginger from an acidic plant from the PT room. First, we clean the lamina flow hood with an ethanol and prepare 5 different types of media. And then we select a healthy leaf cut and wash with 3 times sterile water. After drying, we cut the leaf into a smaller pieces and place 3 pieces to each media plate. And then we seal with a parafilm and observe them every 3 days. During this time, we have made several improvements to get a better result. In our first test, we made sure that all tools were sterile and follow a strict sterilization rules. In our second test, we worked with reducing the time that media and expand were exposed to open air during a transfer and cutting process. Finally, in our last test, we allowed the forceps and scaffold to cool completely before use to prevent any damage to a explant that could affect a callus growth. On our test 1, on day 3, all plates were free from contamination. However, by day 16, one replicate of TDZ plate was contaminated, likely due to our inadequate sterilization. This is possibly because our forceps accidentally touched the media. And the remaining plate were monitored until day 29, but no callus formation was observed. For our test 2, on day 3, all plates show a white bubbles surrounding the explant likely caused by the gas produced by the bacteria. This contamination suggests that our sterilization technique were not effective. And by day 16, all media were fully contaminated with bacteria forming a visible colony around the explant. And for our last test, despite a further improving sterilization technique and reducing exposure time to the air, the result was similar to test 2. Contamination began appearing on day 3 as a white bubble around the explant, and by day 16, contamination was clearly visible. Unfortunately, no usable data could be obtained from this protocol and no analysis could be performed because all plate become contaminated. Even though test one showed no contamination initially, no careless formation occurred, preventing our comparison. Our expectation result based on the previous study suggesting that media containing MS, BAP, and AAA should effectively form a careless formation compared to other media types. This contamination likely occurred due to our increased movement inside the hood, which could disrupt the airflow. And for our lack of successful careless formation, it can be attributed to our competition for nutrient and space between a contaminant and explant. Since leaf explant typically require over 3 months for careless formation due to our necessary cell differential process, this extended timeline complicates our effort further. For future experiment, we need to improve our sterilization technique and reduce our exposure time for explant in open air. To effectively induce careless formation based on various studies, increasing the ratio of cytokinin to auxin can significantly speed up this process. For example, by raising BAP's concentration to 3 mg per liter along with NLA at 2 mg per liter could lead to a rapid careless formation within about 8 days, which is a much shorter than usual 3-month cycle. Additionally, incubating an explant in darkness can help speed up careless formation by reducing the stress and preventing photo inhibition. In conclusion, by maintaining a sterile condition is crucial for preventing a contamination during this process. By improving how we handle tools like scalpel and forceps, we can further reduce contamination risk. And by using a fungicide during a sterilization may also help protect against a future contamination issue. Continuous improvement of our protocol is essential for achieving a better result in upcoming experiments. That's all from us. This is our reference. Thank you.